Hello everyone, my name is Alisha. Welcome and welcome back to my channel. Hope you all are doing well. In today's video, we are going to discuss Aptitude Exam 2024. I've already covered this topic in my previous video. If you haven't watched that video, you will get the link of video in the description below. So please do watch that video if you want to know more about Aptitude Exam. In this video, I have one of my subscriber all the way from India. She was in touch with me throughout her process, and now finally she is here in Ireland and she has started working here as a registered nurse. She cleared her aptitude exam in first attempt. While talking to her about her aptitude exam, I realized that there are some changes being made in aptitude exam. So I thought that would be a great idea to have her here with us on our channel, and let's discuss with her how was her overall experience about aptitude exam. So before any further ado, let's dive in. Hi, Lovely. I welcome you, Lovely, into our channel, and thank you so much for your time.
Hi everyone. Thank you so much, Alisha ji. My name is Lavleen Rodrigues and I'm from India. And thank you for this opportunity. I hope people will find this video useful. And as per my experience, I'll be sharing the things of RCSI exam regarding the theory and practical exam. So I recently came to Ireland in the month of March, and I cleared my exam in my first attempt, luckily. And now I'm working as a registered nurse in one of the HSE hospitals in Ireland. Yeah.
So first of all, congratulations, Loveleen. I hope our subscriber will find this video helpful. I hope through your experience, they can learn more about aptitude exam. So my first question would be here, was aptitude exam your own preference?
Was not my first preference because it's not of my choice, and the employer have asked me to write this exam, which is mandatory, and it's not like either one adaptation or RCSI. For me, it was not a choice, so I had to write this exam.
So I
Yeah.
would like to clarify all my subscriber here. As she said, aptitude exam and adaptation exam. So one of the exam is mandatory to become a registered nurse in Ireland. Choosing a exam is not in your hand. It has to come through an employer. So employer is the one who choose your exam. So her employer unfortunately chose
Yeah.
aptitude exam. So how did you start preparing for aptitude test? As we all know that it's kind of difficult. So how did you start preparing for it?
Yeah, because people don't know what to study for this exam. When we are booking this exam from our email ID or Gmail ID, we'll be getting a link to how to prepare for this exam. And there's a website from RCSI itself, and they have given a lot of information how to prepare for this exam. And there are so many links to prepare for theory and for practical exam. Just because it's all basic knowledge, what we have learned from 4 years of nursing, apart from that, and the basic things of what we already know, and the knowledge and the experience what we have learned from our basic skills. So it's based on all of that.
And how did you prepare for practical? Is it through RCSI or did you prepare on your own?
The practical exam is all about the skills what we know in nursing, and it's not that difficult. It's like I mean, if we rate from 0 to 10, it will be like 5 or 6. It's not that difficult that a person could not write an exam. And I prepared from RCSI website only, and they have given so many videos and links where we can see how they do the procedures, because there are some slight difference what we know as an Indian, like what we have learned from our BSc nursing and how we used to prepare and we used to do things. But here there are some changes because they are explaining more, they are doing less comparatively. So that's the only difference what I found when I learned from the website. And we can also practice basic things like IV administration and drug administration. Like it's more of communication here.
Like once you booked yourself for RCSI exam, you got all the study and practical material and you just use those material. I think that's fair enough because they are providing the study material. So it's better if you use all those study materials and practical material provided by RCSI. So this is about exam, but I would like to know more about it, like overall experience, because everyone talks about exam questions and things like that, but nobody talks about the exam surrounding. When did you arrive?
Yeah.
How was your overall experience? So we'll go through one by one. So how many days prior to exam you arrived here? Is it a week or days?
I think it depends, because some of the employers or the agencies will ask you to come prior to 1 week or 4 days. But in my case, I came before 4 days. And to be honest, I didn't study a lot for this exam, like for not for months and months. I was so busy in packing my stuff and I hardly got time prepared for the exam. And it was just 15 to 20 days. To be honest, like I didn't prepare more than that. What we have learned from our basic knowledge and the skills as I worked in ICU for 4 years, that was the thing which helped me a lot in go through this exam and to learn things. As you asked me regarding the surroundings, so there will be 2 days of the exam, which is for 1 day is for the theory and the other for the practical exam. And when we go for theory exam, they'll be providing us a computer, and that room will be like very very cold, so we have to wear something very warm and go. And also there's a separate building for our RCSI exam, and they are very well, it's very well organized. And when we go inside the hall, we have to keep our phone on airplane mode, and also we have to carry something snacks and especially water for us to have something in between, because it may take a long time. The theory exam will be of 3 hours, but then they'll ask us to come prior 1 hour, and then again they'll be having so much of formalities, and they'll be asking us to show a passport, and some verifications will be there, so we have to be on time.
So talking about theory exam, how many questions were there in the exam?
There were 150 questions and all were MCQs. And it's very simple. It's not that complicated. And it's sometimes the only thing we need to know is, like, a basic understanding, and sometimes our common sense we have to use.
And talking about questions, so was it like combine of all the subjects, or was it more focused toward medical, surgical, or gynae, pediatric, something like that, or was it a mixture of everything?
Yeah, I think it was a mixture of everything, and most of the questions were of nursing knowledge and basic skills, what we have done and we are doing in our day-to-day life. So it was not that complicated, but it was like medium kind of question, medium level of questions.
Okay, and I think Loveleen was so good to prepare some questions which she recalled until now. So I think you have some questions with you.
Yeah, but I think unfortunately I cannot tell all 150 questions, but I could only remember some 10 questions, so I'll be sharing those questions with you guys.
That's fine. So she has some questions which she can recall about aptitude exam. So if you can just read out all those questions.
Yeah, so we'll start with the theory questions. The first one is the selected elements chosen for participation in a research study refers to what? The correct answer was sample. And second one was pre-renal cause of renal failure is hemorrhage. And what is the immediate management of foot on cast? So the answer will be elevate the leg. And number of stages in pressure ulcer is 4. Then full form of COPD, and which is the most sensitive and real earliest indication of increased ICP? It is headache. Then the antidote of warfarin is vitamin K. The major reason for bleeding is in cancer patient is thrombocytopenia. And which organ control body acid base balance? The answer will be lungs and kidneys. The last one is patient feels false sensation, so it will be because of hallucination. Also, I would like to share some topics which you guys can prepare for theory. So the first one will be regarding the code of ethics, the research, fluid and electrolytes, then bones, central nervous system, cardiovascular system, gastrointestinal system, ABG interpretations, GCS, and infections, respiratory system, and also about the ventilation. And some questions were like normal questions, like the basic questions of nursing. So it's not that typical and hard as you can see by listening. You can understand it is not that difficult that that a person could not prepare.
Thank you so much, Loveleen. I think this is very helpful, especially you said all the questions. So
Yeah.
I think it's a more like general nursing knowledge, you can say.
Yes.
And can you remember some of the practical stations, or can you share something about OSCE? Like we know OSCE has 14 station, but what kind of
Exactly.
station? And do you start with easiest station first and then goes to difficult?
So there will be 14 stations, which everybody knows. Like we'll be getting a list of stations, and it is not all together. So, for example, if we have exam on particular day, there'll be 3 slots in a day. So it will be in 3 sections of exam. So if you are in a first slot, then you have to come early morning, and then they'll start with 7 and 7 set. So first 7 stations will be back-to-back stations, and the other one will be back-to-back. So they won't stop in between for anything, and in between you will be getting a lunch break time. Also, in that particular time, you'll be getting some 2 to 5 minutes to read the scenario outside the room when you're waiting for the other station. And then, as you enter in the station, you'll be provided with the scenario, and you have to finish those requirements and competencies in within 10 minutes of the given time. So I'll just go through with the stations now. The first one was for me it was like 7 and 7, so I'll be sharing my experience based on the exam. So the first session was infection control, and it was not that difficult, but then sometimes what happened is we couldn't finish on time. So at that time you have to finish. We cannot rush on things. If you're doing something and the time is going on, so you cannot just miss and skip the thing. You have to do in a particular organized way. Even if you're not able to finish the station, that's fine. You have to just finish the 75% of the competency, so it is okay. So sometimes people panic. So in infection control they asked me for the donning and doffing, and hand rub, hand hygiene, medical and surgical hand washing, and then timings for that, and the HCAI, like hospital acquired infections, and superbugs and examples. And second station was isbar station, where we have to fill all the like isbar, and mine was regarding GI bleed, and then you have to communicate on call with the doctor. So that was not that difficult. It was like easy stations. And in station 3 it was sepsis station, which is very important one, because we here, as you know, we have a separate sepsis chart, and we have to do the sepsis 6 also, which is take 3 and give 3. Then in that sepsis chart they have asked a lot of questions. It was like more than 15-20 questions I had to answer, and that was like, it was very quick enough. And then the fourth one was water loss station. In that they asked regarding the ulcer stages and explanation, and also incident reporting for pressure ulcer. Then the fifth station was admission assessment station. In that it was must tool or the false risk assessment. Either one they asked. In my case, they asked the false risk. And station 6 was wound dressing. So it is a procedure one, so you have to do the wound dressing and show them in very sterile way. Also, we have to clean the trolley at the last of the procedure. Sometimes they may ask as you enter, they ask you to clean, or sometimes after the procedure. Then station 7 was IV infusion, which is NS, and they'll be asking about all the electrolyte imbalances, about the fluid, the content of the fluid and components, like so many questions regarding that. And you have to administer IV fluids for a patient, and all the patients will be dummy, and you have to consider them that they are alive patients. You cannot just deal with them as a dummy, and you should respect them. Also, the station 7 was chest infection management or respiratory procedures, where you have to maintain a good position of the patient and administer oxygen and the nebulization for the patient as per the chart given, and reliever inhaler viva they'll ask. After that, station 7th was oral drug administration and MDI administration, also the drug calculations. So for the drug calculations there will be 8 calculations given, but then you have to do either one. They'll ask you to do either one calculation. So in this station it is very important because they'll confuse a lot. There will be 10 to 12 drugs provided, and they'll ask you to pick 2 drugs. And for example, in my case it was amoxicillin and ramipril, and they asked me to tell everything about those drugs and the nursing considerations. So station 10 was NOK discussion. And this in this station they'll be calling us on phone call, and they'll be shouting, and we'll get panicked, because we never thought like mentally that people will shout at us. They'll act, and they'll make us panic. We should not go blank, and they're checking for our competencies, and they'll ask us to write the progress note, and we have to communicate on call, and we have to console them, apologize, say sorry more than 10-20 times. So this is all about that. In NOK station I got hospital acquired pressure injury. Like the patient got pressure injury in the hospital, so it was like our fault. So for that we have to apologize a lot for them. And then the 11th one was patient teaching. So there are many diagnoses they'll give, but then either one they can ask. For me, they ask osteoporosis, but also they have asked other people like COPD and asthma, diabetes, and CAD. So either one they'll ask. And in student teaching, we have to prepare for stroke, H. pylori, constipation with a colonoscopy, or COPD with bronchoscopy plus IV sedation. So like that they'll ask. And for me, it was stroke plus MRI plus IV station. Then the 13th station is the urine analysis. And in this, they will ask us to do the dipstick test. And also when we are checking for the dipstick, we have to tell them interpretations. And for example, if glucose is high, what does that indicate? So it's like they'll ask us so many questions in that. Also, station 14 was acute management station. in which we'll be having GTN management, like GTN administration plus vital signs. But the recent one they asked, there's a change in this station because DVT is also added, which was not there previously. So now DVT plus compartment syndrome they are asking. And when I was there for my exam, they asked GTN plus vitals. So the lady was shouting in pain, and they're very good in acting. Even I got panic, and as soon as I entered the room, she was lying on the floor and she was acting so much. She was shouting with pain, the chest pain, and I couldn't know, like I couldn't figure out what's wrong with her, that's what my experience was with the stations. And even in chest infection station, she was very breathless, and she was lying on the bed, and they were not listening when we asked them to just sit on the bed and be comfortable, and they shout back on us, like, how can you ask me to sit on the bed? I'm so restless, I cannot do like that. So it was very weird, and they won't listen initially, so you have to convince them.
Yeah, so basically, I think they try to give you this real scenario because in real cases also patient will react in the same way. Patient will scream at you, patient will may sit or lie on bed or on the floor, as you said.
That's
So
what.
I think
Yeah,
they just try to create the real scenario to see how you're going to react to the situation.
that's what. Normal patient won't do like this much. They'll be in pain, but they won't shout on nurses like that.
I think they try to be the rudest patient ever to you.
Yeah. Not only with me, but then with all of my friends, like who and all gave the exam with me or after me, even they had the same experience. And they won't consider, if we cannot cry in front of them, we have to be very bold, being good in communication. That's the thing. That's the main key to pass the exam, is only the communication skills they're checking.
So thank you so much, Loveline, for this detailed information. I think you're well prepared and you remember most of these stations because you just
That's what.
appeared for your exam. So that's a good help. That's a very great help for all the people watching this video. And as you already mentioned that in practical exam, it has to be 75% correct even if we do small mistakes. So they're not looking for 100% correct practical, they're looking only for 75 percentage. But still, if somebody fails to perform 75% correct practical and they fail, for example, in 3 stations, what will be the next thing for them?
Actually, to be honest, first of all, if you're doing preparing well and you're attempting for this exam, and even in case if you're failing, you'll be getting a second chance to attempt the OSCE. And the main part is the theory and the practical. So if you're not clearing the theory exam, you're not eligible to attend the OSCE. So that's how it goes. You'll be getting only 2 chances for both. It's a set of exam, like theory plus practical. So if either one you are getting failed, so the other chance will be for both. You won't be getting a third chance for the OSCE. That's how it goes.
Okay, so if somebody is failing in 3 station, next time they have to come and attend only those stations. But will the
Exactly.
questions remain same or are they going to change the questions?
They usually won't change the questions, but then the scenario will be changed. Also, it depends on which station they failed. Suppose if it is any procedure station such as wound dressing or the IV administration, then the things will be the same. But then if they're failing in patient teaching or the student teaching, so there will be some other diagnosis they may get for the next time. So they have to prepare all the types of teachings that comes under that.
It depends upon the station, what type of station you failed in, and then you have to prepare again
That's
accordingly.
what.
So only for the stations in which you have failed, but question
Yes.
might be different than what you have appeared before. So
Yeah,
after
based
how
on
many
the.
days they are eligible again to apply for OSCE?
It depends when they're getting the next date, because sometimes it may take 15 days or it may take approx a month for the next date.
So this means candidate will have enough time. So even if unfortunately somebody is failing in OSCE station, you'll have enough time to prepare yourself for next practical.
They should try to clear in first attempt, because the second time will be more pressurizing, because it will be the last attempt, isn't it? And if you fail, then you have to come back to your home country and then apply for exam and then again come here for the other exam for the second chance. So it is a bit difficult, isn't it? Like coming here and then
Yeah,
again going back.
very true. Yeah, I agree. So you clear your aptitude test in first attempt and you might have
Luckily.
lots of tips and tricks of your own. So would you like to share some tips and tricks with our subscriber?
Obviously, yes, because there are so many tips and tricks which I got to know after writing my exam, because nobody, even I didn't know before writing my exam. Nobody told me all those things. As you have mentioned, the passing mark what they're looking for is a 75% in particular station. Because to be honest, even I have done so many mistakes in the station. As everybody know, like nobody is perfect, and we cannot do perfect things when we are in stress, or we are so much pressurized, and we are panic, and so it was just 75%. As the mistakes what I did is, when they asked me to give nebulization, and in the chart it was mentioned only 5 ml, but I have given 10 ml of nebulization. So but then I we have to apologize, and you have to acknowledge your mistake, and then you should ask sorry for that. So that's the main thing they are seeing for. And the second thing is, you have to be very confident enough to answer their questions. Even if you don't know anything, you should not keep quiet. You should answer something related to the topic. Also, you should not panic, because when we get scared and we'll take too much of stress, even if we know something, that thing also we'll forget. So it's the thing, you should not do that. And Irish people are very good in acting, so you have to be mentally prepared, well prepared, that they will shout at you, they will make you panic, they'll make you to keep quiet, and whatever they're asking, we have to answer that thing. If something extra we are telling them, then they think that we have already mugged up the answers and we have come here. So which is the thing they don't like. So even if you know something, you should answer whatever is asked. You should not give any extra information. So for example, if they're asking definition of sepsis, then you have to give only the definition of sepsis, not any signs and symptoms. So as a trick, tips and tricks what I got to know. Yeah.
So I think these tips and tricks are very good, and I hope you'll find it useful when you'll prepare for your aptitude exam. So, how would you rate the difficulty level of aptitude exam, like a pain scale on a scale of 1 to 10?
On a scale of 1 to 10, it will be 5 or 6. I think 6. But then we have to prepare properly, because we cannot take this exam for granted. Because after so much of struggle, we are writing this exam. And after the whole long process of Ireland, first of all, it takes a long time. And it's the last step to get your pin. So I think you should prepare properly and then write your exam. So it is like medium level, not too hard, not too easy.
Well, I agree with you. It's medium level, whether you go for aptitude or adaptation, it's a medium level difficulty because you're already a trained nurse. And if you're coming to Ireland, then for sure you are more than 2 years experience. So you know what you're doing and you know what are the things like in nursing. And what do you think? What is the most difficult part of this exam for you? And what can be the difficult part of somebody who is appearing for this exam?
Mhm. I think the communication skills, because sometimes what happens is we know the answer, but we're not able to communicate in English. So that's what I felt in some stations, because they have asked me such tricky questions, and I was just blank for 2 3 seconds, and then later I have answered. It's not like I didn't answer them, but then it took time for me to think and analyze and then answer. So it's the only thing I felt it is difficult. Also, second thing is mental preparation, because I didn't expect that they will do such a good acting. As soon as I entered the station, they were lying on the floor, and it was so difficult for me to ask them to get up and come to the bed. And it was like 3 stations I faced like that. And my first station was chest infection, where they were wheezing and lying on the floor. So that was the experience I had for the exam.
I think that's a very true answer because these two can be a hurdle for anyone. Communication and mental
Yes.
preparation is very necessary. Even in my previous aptitude exam preparation video, I have explained this that mental preparation and English is a major thing and it can be a major hurdle for you. So you
Mhm.
need to prepare well, and I think you need to improve your communication skills before you appear for this exam. So thank you so much, Loveleen, for your time. And I hope you're finding it nice here in Ireland. And I hope you're settling in well here. Thank you so much for all the valuable information.
Thank you so much, and wish you all the best for your exam and whoever is preparing for the exam. And thank you so much, Alisha Deep, for this great opportunity. Thank you.
So friends, that's all about aptitude exam. If you find this video helpful, please give this video a thumbs up and share this video with your friends who are preparing for aptitude exam. Please don't forget to subscribe to this channel if you haven't. If you want to speak to me personally, you can contact through TopMid. Link will be in the description, or you can contact me through Instagram. Until next time, bye bye. Take care of yourself and your family. I'll see you in my next video. Thank you so much for watching.